This program is sponsored by the Bridgeview Medical Plaza, 7124 West 83rd Street, Bridgeview, 708-233-0707. Dr. Rashid Abu Shanab, chiropractor in the Bridgeview area since 1998. Bridgeview Medical Plaza, offering chiropractic services, acupuncture, massage therapy, weight loss, vitamins, herbs, decompression treatment, and blood testing. Now, adding medical services with Dr. Usama Zarab, dentistry with Dr. Salah Akhras and Dr. Rabih Salama, pharmacy services with Dr. Miriam Abdelrazak. For lower back pain, neck and arm pain, injuries secondary to auto and work, high blood pressure, diabetes, cholesterol, or any medical condition, please stop by for a free consultation. Consult Dr. Rashid Abu Shanab in the Bridgeview Medical Plaza at 7124 West 83rd Street in Bridgeview, 708-233-0707 or www.drshanab.com. Yahala Voice is welcoming Dr. Rashid Abu Shanab and his team for his weekly show. And now please welcome Dr. Rashid Abu Shanab.
Yahala with Dr. Rashid Abu Shanab is a weekly show hosted by Yolia Rouhani and myself, Dr. Rashid Abu Shanab. We thank you for tuning in today. This program is sponsored by the Bridgeview Medical Plaza. Dr. Rashid Abu Shanab, chiropractor in the Bridgeview area since 1998. Bridgeview Medical Plaza offering chiropractic services, acupuncture, massage therapy, weight loss, vitamins, herbs, decompression treatment, and physical therapy. Bridgeview Medical Plaza also offering dentistry with Dr. Saleh Al-Akhras and Dr. Rabih Salama. Pharmacy services with Dr. Maryam Abdelrazak. And now, just joined the plaza is Dr. Osama Zarab, a medical provider for all patients with high blood pressure, urgent care, arthritis, diabetes, heart conditions, lung and respiratory conditions. Zarab Medical Center, located at 7124 West 83rd Street, Suite C, in the Bridgeview Plaza off of Harlem and 83rd, 708-599-9250 inside the Bridgeview Medical Plaza. And with us in the studio today, a landmark in the medical field as a whole, and specific to the Arab community in the Chicago area, Dr. Osama Zarab, a licensed Illinois and Indiana medical physician. Hello, Dr. Osama, and welcome to our weekly show.
Thank you, Dr. Rashid Abu Shanab, for this great introduction.
Thank you, Doctor. Dr. Osama Zarab, I just want to introduce yourself to the community. You are a licensed Illinois and Indiana medical physician affiliated with Christ Hospital, board certified in internal medicine, and I know you had multiple awards, mashallah, top internal medicine specialist in Chicago in 2012, recognized by International Association of Internists edition in 2012 and 2013, Patient Choice Award in 2010. You've been selected as one of the Illinois favorite physicians in 2010. Mashallah, an MVP award 2008. I thought MVP only for football players, but Smallah, mashallah, MVP award in 2008 at the Advocate Christ Medical Center, Hope Children Hospital, and November 2008 Value Leader for Compassion with Patients. And I know, Dr. Osama, you did some publications in 1994, I would remember. I read an article about that, Zarab, about the acute ethanol inhibit calcium influx in esophageal contractility.
That is correct.
What is this publication about?
Yeah, that was early when I was after my graduation from medical school. I did at Loyola University. It was, I did as a GI fellow. Oh. So I did a research, and that was to check the effect of alcohol on the esophageal reflux. Oh, okay. So we did successful study on cats, esophageal sphincter of the cats, and we proved that ethanol can worsen um, the what we call gastroesophageal reflux.
Okay. Yeah, we see as some kind of esophageal reflux. People have like heartburn or something.
Exactly. The acid from the stomach can get back to the esophagus and cause chest pain. بالعربي حرقة. عرفت كيف الصدر وحرقة في البطن فهذه طبعا الكحول can make it worse.
In the beginning, Dr. Osama, we at Yahala Voice welcoming you to our show and congratulate you and your associates for the new center in the Bridgeview area. This is your second location in the Chicago area, Dr. Osama?
Yes, indeed, I have another office, which is the first office I started, which is close to Christ Hospital. It's in Cicero and 103rd Street.
MashaAllah. So that's good. So inshallah, both centers will be very successful, and thank you very much for coming. So today we are discussing three topics: diabetes, high blood pressure, and cholesterol. Dr. Sama, you see many patients, very much, maybe 90% of the patients that you see diagnosed with one of these or maybe all of these. So can you please elaborate a little bit about maybe the first topic we'll pick is diabetes. Like what is diabetes in general?
Okay. Before I talk about diabetes, I want to say that these three conditions contribute to a lot of problems in to the health.
Mm-hmm.
And this is why we choose them most of the time to talk about them. Right. These are the most common problems that we see in the practice. Diabetes mellitus is a condition where the body or the pancreas is unable to keep the blood sugar in the blood sugar within the normal level. So the blood sugar goes higher than the normal level, and if left without treatment, it can cause a lot of damage to the body on the long term. Mm-hmm. There are two kinds of diabetes. Type 1 diabetes, when there is destruction of the cells that secrete insulin in the pancreas, we call them beta cells. Mm-hmm. When these cells are destroyed, of course, there are different degrees of destructions, and that reflects on the medical condition itself. So that will cause the blood sugar to go high because there is no enough or sufficient insulin to bring down the sugar to the normal level. Okay. 95% of these cases are related to something called autoimmune. Mm-hmm. Which means that the body the immunity system generates antibodies against these cells in the pancreas and cause their destructions. 5% only, we call it idiopathic, means we don't know why it happens. We run all kind of tests and we don't know.
Right. So the type 1, this is the one with insulin?
Right. This one, we need insulin because the pancreas is damaged and you need to give insulin. Now, most of these cases happen in children, but it doesn't only happen in children. It can happen in adults. Now, why this damage happen? We said 95% because of circulating antibodies from the immunity system. Well, we know that 2/3 of the cases are environmental and 1/3 only is genetic. Genetic mean it's inherited. Mm-hmm. Okay. So the 2/3, which are environmental factors, we don't have solid statistics to tell us what is the specific cause. We think measles, mumps, rubella, some other viral infections can cause that. Yeah. But really, the problem is because most of the effect or symptoms of diabetes appear after a few years from the infection. We cannot tell which environmental factor causing that. Right. So that's type 1.
Type 1. Mm-hmm.
Now, type 2, it has 50% 50% environmental, 50% genetic. In this case, it is not caused by destruction of the beta cells that secrete insulin in the pancreas, but it is because the body either because the pancreas first can is secreting insulin, which is not enough to bring the sugar to the normal level. So you may not need to give insulin. You just need something to make the body sensitive to your own insulin, or to stimulate your pancreas to give more insulin.
So just like
And we don't need, in this case, insulin. We just rely on, of course, besides medications, change style of life.
Right. So you mentioned something about normal level of sugar. So what is a good normal level of sugar? Like fasting. I know there is too many research, and every day there is a new number. Some people say 100, 110, 109. What is, in your practice, what is a good normal level, fasting normal level? Like when patients come in to you and say, Dr. Osama Zarab, my blood sugar in the morning is 140. What do you recommend for that?
That's a good question, Dr. Rashid Abu Shanab. The okay, let's say normally the fasting blood sugar shouldn't exceed 100.
100.
Now from 101 to 126 and a half, I know it sounds like funny. Why 126 and a half? This is what all the statistics came down to. It's considered the gray zone. You're not really diabetic. You're pre-diabetic. But if you do some changes in your style of life, you can go back to normal level. And if you don't and it gets worse, you can become diabetic. You become diabetic officially if your blood sugar always after more than 127, let's say, in the morning.
Yeah.
Now, if somebody checks his blood sugar one time, it's not enough to diagnose diabetes.
Right.
And after you eat, the blood sugar should not exceed, normal people less than 160, less than 140. If it exceeds 200, that is diabetes, of course, in more than one occasion. So that's basically, but you're right. There are still, a lot of debates about what exactly the cutoff and all that.
Right. It is a little bit confusing. Now, how about the hemoglobin A1C, or بالعربي we'll call it التراكمي? Is there any specific numbers we should look into as well, since we talk about normal levels?
Yeah. بالنسبة للتراكمي اللي بنقول له hemoglobin A1C, the blood, it doesn't really read how much sugar in your, the exact glucose amount in the blood. It reads the carriers of the sugar in your blood. And normally, if you look at normal person, how many carriers in the blood for the sugar, it's usually 4.5 to 5.5.
Right.
Now, if you are diabetic, we would like hemoglobin A1C to be less than 7. And to be excellent, it should be less than 6.5 even.
Right.
We cannot diagnose, we cannot use it for diagnosis or for like accurate diagnosis. We prefer to do other methods, like checking your blood sugar multiple times a week, before fasting in the morning, and after you eat your good meal, heavy meal.
Right.
Some people don't check their sugar after they eat because they think it's inaccurate. No, it's, as a matter of fact, it's more diagnostic to know how much after you eat is your sugar.
So you don't recommend us do it after a knafa plate or مقلوبة ولا شغلة? No.
Well, if you want to get suspicious about yourself and worry and confuse, yes, you can do that.
Okay. Now, how should I say that? How am I, as an average individual, would know if I have diabetes or not? What the symptoms should be, a red flag for me to go ahead and say, Dr. Osama, I maybe have diabetes.
Okay. In the medical term is polydipsia, polyphagia, polyuria. What does it mean? You feel thirsty all the time. If you start to feel thirsty all the time, if you start going to the bathroom a lot and drinking, of course, a lot of water, if you feel hungry, all these are signs that you should worry about, that could be diabetes mellitus. And honestly, if it reaches that level, if you are really drinking a lot of water and going to the bathroom a lot and feeling hungry all the time, there is a big possibility that you have diabetes, and you better go and check yourself with your doctor.
Gotcha. Now we discussed the types of diabetes. We discussed, the symptoms of it. Now, let's say if somebody already diabetic and decided, unfortunately, we have a lot of patients like this. They decide, well, I'm not going to do much with it. It is what it is. They don't check their blood sugar. They don't do anything. What is the complications? What could happen?
Okay. Diabetes is like the mother of most of the complications in the body. Diabetes can affect your heart. It's one of the risk factors. It can cause kidney failure and put people on hemodialysis. Of course, it's also one of the risk factors that can affect the blood vessels of the brain and cause a stroke. It can affect the arteries or the blood vessels of the extremities. So people start having numbness, tingling in their legs. They may have also decreased circulation, what we call, and people may not feel anything when they hit something in their feet, and they can develop. I'm sure, Dr. Abu Shanab, you see a lot of probably these cases. They come with problem in their feet, and sometimes even it prompts amputation of their toes.
Yeah, some people come in, unfortunately, with bruises, and you ask, well, what this bruise come from? They say, I don't remember. It's like, and maybe this is because they are unable to feel that.
Exactly.
So what's a good prevention for diabetes besides not eating knafa? I'm not against knafa, guys. Don't get me wrong, but it's just easy to say, and everybody knows it. I love knafa, by the way. I eat it all the time, but nothing personal against anybody.
Me too, but I exercise and I make sure I burn it.
So how to prevent it?
Okay. Well, first of all, if you are, if it's caused, if it's type 1 diabetes, sometimes you can do nothing about it.
This is the insulin. The type 1
This is the
insulin
yes,
dependent. Okay.
insulin dependent diabetes. That's type 1. Because the pancreas is already destroyed. Okay, so you need exogenous insulin, or another word, insulin that's not from your body. But still, of course, if you change your style of life and exercise, etc., you at least will be able to maintain it with a normal level and avoid the complications.
Right.
Now, if it's type 2, which is very important, we didn't talk about type 2 a lot, but really the number one factor beside genetic is obesity.
Right.
Obesity can cause increase of the resistance to your own insulin. So changing style of life, losing weight, exercise will definitely make your body more sensitive to your own insulin and can prevent diabetes.
Right.
So definitely watching what you eat, cutting down on carb, exercise, weight loss, all these measures help big time for you to control your diabetes. Now, how to prevent, again, genetic, you cannot, because that's not in your hand, but you can always make it better by controlling it with a change of style of life. But if it's because of obesity, then obviously weight loss.
Right.
I do have patients who really were obese, and I started them on oral hypoglycemic medications, and they did lose a lot of weight, and eventually they were off the medications.
Very good. For diabetes, blood pressure, and cholesterol, for consultation, please stop by the clinic at Dr. Zarab Medical Center at 7124 West 83rd Street, Suite C in Bridgeview, off of Harlem and 83rd, 708-599-9250. Dr. Osama, what kind of insurance companies does your office take?
We take most of the insurances, all, of course, Medicare, commercial. Medicaid depends on if we are on their, my name is on their insurance or not. But basically, Aetna I think Health Partners are one of the very good Medicaid insurance that I promote. Most people who have Medicaid, public aid, to switch on it, it's an excellent, probably is the best public aid one.
Great. So, but if somebody would like to come in for a consultation, he can just call your office or stop by for a possible free consultation from Yahala?
Absolutely,
Thank
absolutely.
You. Thank you. Well, the second topic we need to discuss is high blood pressure. I know we spend a lot of time on diabetes, which is really such a huge. But if we touch a little bit on blood pressure, doctor, I'm sure everybody have blood pressure, but we talk about what is high blood pressure.
High blood pressure is when you have what we call sustained elevation, means all the time the blood pressure is above certain level. Now, the pre-hypertension is when it's between 130 to 139. Um,
That's the top number. The systolic.
right, the
Okay.
systolic. Now, diastolic, of course, 80
Okay.
to 90. And now, above 139, this is, of course, in multiple setting, it should be, then this is hypertension. Now, you cannot just check your blood pressure one time and say, well, it's high. Definitely, there is something called physiological elevation of blood pressure. Another word, under certain physical or emotional stress, blood pressure can go high, and that's normal, and then it should come down. Now, if it doesn't come down, if it's always high, that's called hypertension. But if it goes high sometimes, but most of the time it's normal, it's 125, 130, 100, even less than 135, that's normal.
Good. So the idea is to go and get it checked the first time. Oh, it's high. Oh, I have high blood pressure. Here's medications. It's not the case.
That's wrong. And unfortunately, some places they may do that, which is wrong. No, the patient should always consult his physician and seek the right advice.
Okay. Now, for blood pressure, just like diabetes, you mentioned something about the going to the bathroom a lot, the drinking, thirst a lot and hunger. Now, how about high blood pressure patients? Most of your patients, what kind of symptoms they have that you might think about, they may have high blood pressure?
That's excellent question, Doctor.
I'm doing good today.
No, you are very good, as usual, really.
Thank you very much.
Thanks, Rashid. Here is the situation. Most of the time, people don't know they have high blood pressure. They don't. Well, sometimes they have headaches, and they come to the doctor, or they check it, or they have headaches all the time, and they come with high blood pressure. But the majority of the cases, they don't know until they go to the doctor for like general checkup, and you check it, and you find their blood pressure like 160, 170. So it is a silent disease sometimes, and it causes a lot of damage. Some people, unfortunately, comes with bleeding in the brain. Okay, and that's like a bleeding stroke.
Yeah.
And they don't know it. Some people come with heart attacks. So, yeah, it can be a silent disease, and this is why you are advised always to at least have one annual visit to your physician to check your blood pressure. And if you do it yourself from time to time and you see it's always elevated above 145, 150, you better check with your doctor.
Right. Well, and this is what I remember you mentioned something about that. Your medical assistant offering a free checkup on high blood pressure. If you are in our area, please, if you are in the area of 83rd and Harlem, please stop by the office, whether an appointment or not. We'll be more than happy to take your blood pressure. It will take like 2 minutes of your time, but it will definitely make a big difference. So checking high blood pressure is such a big thing, Dr. Osama, and I like the idea how you said it. It's like a bomb. You don't know you have it or not. You just need to really check it out and be sure that you don't have that. And not from the first time. You have to do it more than one time. So the complications of high blood pressure, you mentioned something about the stroke, but how about if there's, blood pressure and diabetes on top of it?
Okay. There are 5 risk factors for heart attack, for cardiovascular disease, for basically. I will mention 5 of them. One is diabetes mellitus. The second is hypertension. The third is high cholesterol. The fourth is genetic or family history, a strong family history like your father or your mother or your brother.
Is mother-in-law involved?
Mother-in-law depends on how much she likes you. So.
Okay. So it's not 100% really. Okay, I'm just touching base.
Yeah, that's a good question. And the last thing is smoking.
Okay.
Now, don't tell me argilla is not included. Of course, argilla is included in smoking.
Okay.
Yeah.
Now, we talked about prevention of diabetes. Now, how about prevention of high blood pressure?
Okay. 90% of the cases, we call it essential, mean unknown etiology, and only 10% we know it's related to certain diseases or medications, etc.
Right.
Now, the prevention, definitely a style of life helps. Like obese people can develop diabetes, can develop hypertension. I have a lot of people really, they watch their weight, they lost weight, and their blood pressure become really normal. I mean, we had to stop medications because blood pressure became normal.
Excellent. Excellent.
The second thing is eating a lot of salt, especially if you have family history. That can elevate your blood pressure. We have patients already have hypertension. When they eat salt, they come with heart failure or other problems. So again, change the style of life, healthy style of life. Try to lose weight. Try to exercise. But let me tell you, sometimes you're very slim, very thin, and it's genetic. There's nothing you can do about it. So the only thing is to really seek medical advice, take medications, and don't take it. Don't underestimate the effect of uncontrolled hypertension. You can have stroke, you can have heart condition, etc. So certainly take your medications if it's genetic and you can do nothing about it.
Well, Dr. Osama, we are very close on time, but can we touch a little bit on cholesterol? Because it came up in more than one time. So what is cholesterol? What's happened? You know, we all have cholesterol, normal and abnormal, triglycerides and everything, but just a little synopsis about cholesterol, please, due to time.
Sure. Quickly about cholesterol. Cholesterol is an animal fat. As a matter of fact, we make cholesterol by just getting exposed to the sun in the morning or at sunset. Our skin can make cholesterol. Cholesterol has two types. One is bad, one is good. The good, it prevents the hardening of the arteries, while the bad get precipitated in the arteries and causes stroke, heart disease, and other cardiovascular diseases. Now, what to do about cholesterol? Well, cholesterol is rich in, when I say animal fat, I mean, don't let somebody tell you olive oil doesn't. Of course it doesn't. It's a plant.
Right.
It's an animal. The richest is the yolk of the egg, which is safar al-bayad. And the second is cheese and milk, and of course, red meat.
Right. You know, I think also, I'm not sure about it, is the shrimp.
Shrimp, yes, it does have cholesterol, and all shellfish do have cholesterol. So you have also to be conservative when you about these things. Certainly, it is an animal, as we said, source. You have to really watch it, and of course, genetic also.
Yeah.
And some people very slim, they are vegetarian. And they still can have a very high cholesterol. It depends on how their liver makes cholesterol.
So with cholesterol, definitely we need to do a blood test. But do you have to be fasting for that, or?
Yes, absolutely. Blood for cholesterol, you have to be fasting 10 to 12 hours at least.
Well, this show is sponsored by the Bridgeview Medical Plaza. If you have symptoms or any questions about high blood pressure, diabetes, weight loss, urgent care, auto and work injuries, arthritis, dentistry work, any questions about medicine, and all your medical and dental needs, please stop by our office. We are at the Bridgeview Medical Plaza, 7124 West 83rd Street, off of 83rd and Harlem in Bridgeview, 708-599-9250. From Yahala Voice, Yulia Rehani, this is Dr. Rashid Abu Shanab, thanking Dr. Osama Zarob from the Zarob Medical Center, from all of us at the Yahala Voice, and thanks to all our listeners for tuning in.
Thank you, Yahala Voice, and thank you, Dr. Rashid Abu Shanab, for this opportunity.
Thank you.